you for coming today. Today we will be discussing cochlear implants. You will find this very exciting and you will learn a lot of information. It's a very informative speech, but sometimes tends to move a little bit over to the persuasive side. So in essence, it can be a little bit of both. We will start off talking about cochlear implants, and a little later, I'll just add a little bit about the deaf community and the controversy that they have with the cochlear implant. But right now, let's concentrate on the cochlear implant. A cochlear implant is a device used by deaf people that have a very profound deaf problem, and hearing aids cannot help them. The cochlear implant is used when testing is done on the deaf person, and it finds that with their cochlear, it just does not work properly. There's a problem with the hair cells of the cochlear. It just doesn't respond. So with the cochlear implant, when it is implanted, it can really help with that situation. Now, let's be very clear about something. The cochlear implant will not restore the deaf person's hearing, nor will it cure their hearing problem, but it will help with sensation and perception to help the deaf person. Okay, let's see. What else should we talk about with this cochlear implant? Now, there's benefits with the cochlear implant. There's three great things here. So our first thing is we have to recognize the age of the patient and when they start having a language deficit. Second, we have to see whether the hearing loss was at birth or when they were a small child. And thirdly, we have to see the motivation on the family side as well as the patient. So there can be great benefits here, but there must be a lot of help with the family as well as a lot of motivation from the family. Okay, now, how does the cochlear implant work? Well, the cochlear implant is external on the outside as well as internal on the inside. So with the external part of the cochlear implant, it's like a microphone, like waves going out. And that's how it helps with the speech processes. And internally with the cochlear implant, we find that let me see, I want to make sure I get this right. Yeah, with the internal part of the implant, it's a receiver and like electrodes, that goes out. And with this cochlear implant, it bypasses the cochlear and it bypasses the problem that the cochlear is having, and it goes directly to the sensory part of your hearing. So that's how the cochlear, in a small sense, it's a lot more in depth, but we don't have that much time with this speech today. So we'll do a very small, little beneficial presentation on that. Okay, so now that we've learned what the cochlear implant is, that it's a device that helps with your hearing, won't cure it, won't restore it. We also understand that the cochlear implant is very beneficial to you because it helps with language deficits. It helps with the sensations and different things like that. We have also learned that it's an internal as well as an external part. What else should we learn about the cochlear implant? And also, I will start saying CI, so you'll know that that means cochlear implant. Okay, where can I get a cochlear implant? Do I just walk into a store and get it and purchase it? No, you cannot. You will have to have a doctor's referral. And so you go into a cochlear implant site where there will be a lot of testing done. Now, this testing can be hearing tests. It would be like by an audiologist. That's a hearing doctor that tests your hearing and makes sure that you hear what you should be hearing. There will be all kinds of tests. There will be audiology testing. There will be psychological testing, as well as medical examinations, and testing is also performed by a surgeon. So you see, this is a kind of detailed process here. And a lot of notable people have cochlear implant. I believe if you know the talk show radio host, Rush Limbaugh, if you look at him, you will see the cochlear implant embedded in the side of his head. And also, I do have a few illustration pictures here for you so you can kind of get an idea of what I'm talking about when I talk about this cochlear implant. Here I have a picture of a gentleman here. As you can see, I want to make sure you see it real good here. As you see, he has a cochlear implant here on the base of the back of his head, and as well as here with on his ear. It kind of acts like a hearing aid, but not a hearing aid, much more advanced. So as I talk about the CI cochlear implant, you will see here what it looks like. And that way you can get a better idea of what I'm referring to and what I'm talking about. And it's not only an adult thing, it's a child's thing as well. And you can see here, here's a picture of a child with a cochlear implant, and you can see how this is implanted in the base, the back of his head. And here's a full picture where you can see the child clearly here, how he has the implant, how it's around the base here, and then goes planted into the base of the head, and it kind of looks like he has on a hearing aid, but it's much more advanced than that. Okay. So now that you see the illustrations, you will understand exactly what I'm talking about when I say cochlear implant and how it works and what it does. Okay, so so you can't just go and get this, right? So we learned that we can't do that. We have to go and get all these examinations, and definitely they will be performing an MRI for this procedure. That's really important so they can see what's going on and what's happening with this procedure here. Okay, so the process, it involves, as I said, x-rays, MRIs, testing, audiology, psychological. As you see, this is a really deep process here. Okay, and what happens with this? How long do you have to be out of work? Do you have to be out of work for weeks and months or years? No, it's a very good procedure. Like after 4 to 6 weeks after surgery, the patient returns to the center and is tested to see how well it works, and that's just within a 4 to 6 week process. And if it is working properly, then everything will be just great. So you see, the cochlear implant is a very good device. According to its makers, according to its distributors, they feel that it's a good product for the deaf community itself. Okay, let's see what else we should learn. Who is best suited for this cochlear implant? It's generally for adults. They should have very profound deafness, and they should have limited benefits that just didn't work well with the hearing aids. And also, there should be no other no other surgeries that they had that was really risky. So they should be in really good health. And the fourth thing is they should have a desire to be part of the hearing well. So nobody should really be forcing them to get a cochlear implant, as we'll talk a little bit about later with the controversy. Okay, and is it just for adults? No, it's not. It's also available to children as well. And what is the ramifications for a child to have a cochlear implant? It's pretty much the same as adults, but with a few differences. One of the differences is, as I said before, they have to be really involved, parents, with this procedure. And also, there's many steps involved in the process with the child. They have to understand, along with their parents, what is their role in the success of having the cochlear implant. So it's really a good thing for them to have. So we see here that there's going to be a lot of rehabilitation and a lot of other things involved. So we're very excited about this cochlear implant according to their makers. So we're learning a lot of information. You have to decide as a consumer whether this is good for you or not good for you. So that's why I say it's kind of an informative versus persuasive. It's really up to you which one you think that is really best for you. So now that we have learned all about the cochlear implant and what it entails, and one more thing I also would like to say, you know that 90% of deaf children are born to hearing parents. They are. And this is, so this is why the cochlear implant is important in their opinion, because sometimes I guess the hearing parents may want the child to hear. So that's a very good small overview of the cochlear implants, what it does, how it works, and who should have it. Now, as we mentioned, let's back up. As we mentioned earlier, that we will talk a little bit about a controversy within the deaf community about this implant. Technology has been wonderful for the deaf people. They have been able now to do telecaptioning as well as telecommunication using their devices. It's been really informative to help them use telephones as well as the television. We have the closed captioning. We have the TDD. So technology has been really great for the deaf. However, there has been a really notable resistance to this cochlear implant within the deaf community, and especially when it comes to deaf children. They're not really that comfortable because the deaf community, well, it's like kind of a half and half. Half is not sure if it's like some kind of miracle cure, and the other half is not sure if it's maybe like a form of genocide. So it's up to you as a consumer or parents of a deaf child to really do your research and to see what is best for the child. Okay, this controversy is the most sensitive thing that's happening within this deaf community today. It's just the same as language is oralism to a hearing person. A deaf person feels with this cochlear implant that a child especially, they're really not pleased with the child, really, because they feel that it doesn't give the child a chance to understand its heritage, its culture, its deafness in itself. It tends to send the children off to regular schools, or what you may say mainstreaming. And with mainstreaming, you basically have regular, what we call normal school teachers. So the child doesn't really get a chance to understand its deafness and who they are in this world and in this society. So that's why a lot of deaf activists are not very pleased with this cochlear implant, and half of the deaf community as well is not. So there is a controversy. It's a very notable one, as I stated, within the deaf community. The deaf activists, they really have two big problems with this cochlear implant. And their first problem is they believe that implanting children so very young encourages them not to want to learn about their deafness, to only be concerned about hearing and not understand who they are and what they are about, because culture is just so important. So you see why this speech may take on a little persuasiveness to it because of that problem. Is it or is it not? Who can say? Okay, so the second thing deaf activists feel is that putting it denies them their heritage, especially their ASL heritage. They won't have a familiarity with the language. They won't really understand their deafness. They won't really understand their culture. So the deaf advocates are very concerned about this, and they just is not happy about this at all. So deaf people who have this implant, what happens with them? Are they no longer deaf? Are they still a part of this, what we call deaf society? A lot of the advocates feel, especially with a lot of the deaf community, they feel that this action is just like genocide. That's a big word, genocide. They believe it's like the Nazis. They think that back in history, that the Nazis enjoyed experimenting on children. So this is what they feel about this cochlear implant. So as I stated, the consumer is going to have to be the one that decide what is best for their child, what is best for their loved one, whomever that may be. So it is a big thing going on. It really is. So it's all up to the consumer. No one can persuade you. All I can do is present the information and give it to you, and let you as a consumer decide what is best for you. So we understand that it's a good technology. It has helped a lot of deaf people. We understand that. We understand that technology is really being good in the deaf community. That is great. But it's a very sensitive subject in the deaf community. And the deaf community really feels this way about it. Deaf people who have this implant, okay, are they still deaf? Are they a part of the deafness? Some feel that deaf people may be considered deafies, or more hard of hearing, or hearing wannabes. They think they might be hearing wannabes. So in essence, what they're saying is, even though they have that cochlear implant, they may not even be accepted in either side, whether the hearing side on this side or whether the deaf side on this side. The deaf advocates feel that either way, they are not going to be accepted as full members into either group, the hearing world or the deaf world. Which one do we go? Which one will the deaf person be accepted in? And as far as the deaf advocates is concerned, they won't be accepted in either. So, as a consumer, you are going to have to decide which is best for you. No one can make that decision for you. No one can tell you whether you are right or whether you are wrong. You have to decide as the consumer what is best for you. So let's make sure that we didn't miss anything in this report, because I want you as a consumer to be sure about what's going on. And as I said, so you can remember, so this will give you an idea of what you're going to have to decide. This is what your child will be wearing. This is what they will be looking like. So, is that acceptable to you? For many, it is. And that's their choice. Nothing is wrong with that. We all have a choice in the matter. So for a child, as you see, that's how they will look as a child. And as I showed you earlier, here's a full picture of a deaf child with a cochlear implant. So this gives you an idea of what that looks like, because some of you might be saying, oh, I don't even know what a cochlear implant looks like. I don't even know what that's about. Well, this is what it's all about. And here is a gentleman. They're showing you very clearly what he looks like and how it fits in. So you have to decide, is this what you want? Is this what you want your child to have? Or do you want them to just be a part of the deaf community? Do you want them to be mainstream? Mainstreaming means going to a regular school with regular teachers, teaching them. Sometimes they may get lost within that shuffle because they don't really understand what is going on and how it is going on. So, as you see here, little informative, maybe even a little persuasive, but in the end, you will have to decide what is best for you and what is best for your loved one. I am so glad that you were able to attend this brief seminar here on cochlear implant. Thank you so very much, and I hope that you can spread the word, tell some of your other friends about the next seminar, and thanks so much for coming. We appreciate you being here. Thank you.